Hatfield, and welcome back to Healthcare Consumerism Radio. And on this segment, we're going to be talking to one of the leading administrators in this space, and speaking on their behalf, and who will also be joining us at Forum is Bart McCollum, COO of Ameriflex Business Solutions. Bart, good morning.
How are you? Good to be here.
Yeah, good to have you here. Where are you coming from today?
I'm actually calling you from Frisco, Texas. Our headquarters in Frisco, Texas.
Yeah, is that home?
Yeah, I live in Dallas, and Frisco is basically a suburb, kind of metropolitan area there.
That's great. Well, good to have you here. You know, on the last segment, we had Chris Covell with Mercer Marketplace talking about what they're doing in the private exchange area, and it's very interesting to hear them talk about the niche and where the market's going. And I think there's a big impact to you, the administrators. And talk to us a little bit about what Ameriflex Business Solutions is doing in this fast-changing exchange environment.
Yeah, that's a fantastic question. We actually we've done a little research, and there's 127 different companies that have some kind of a private exchange offering that they're either developing or have already developed. And so our view is that there's probably going to be a few winners and a lot of losers in the marketplace in terms of what a private exchange ends up being, who ends up offering it, and how it ends up serving employers. And that's on the private side, and obviously not the healthcare reform side, public exchange side. So what we're focusing most of our time on is, and conveniently for us, since pretty much our mission is to help employers try to engage consumers and try to help them save money while offering rich benefits, it's really just a continuation of that. We sell primarily through benefits brokers and consultants, and so what we're trying to do is develop tools and educate that constituency about healthcare reform and about how they can bring more value to their employers, because they're selling our products, but obviously because employers are going to be more confused than ever, and costs are going up faster than they ever have before. So it's really kind of supercharging the mission that we already have in what we're doing.
Now, Bart, with a lot of your relationships being on the broker side, what is the conversation amongst the brokers out there regarding these private exchanges?
Yeah, that's a fantastic question, and I've heard just about everything, and it depends upon the broker that we're talking to. We work with some larger brokers and some more sophisticated brokers that have either kind of private labeled their own private exchange or are developing one. And the thought among them, and probably a theme you're hearing from a lot of the people that you're interviewing today, and probably a lot of people at the conference, is that we're moving into this reality where this defined contribution idea, this fixed dollar idea, where an employer is going to offer a certain amount of money, and then you're going to pick what you want as an employee from some list, and that list can be called an exchange, is kind of what the reality is going to be when an employer is continuing to offer benefits. And so I think the more sophisticated and maybe better funded benefits professionals out there are trying to position themselves to be able to offer that option and maintain their relationships with their employers because they see the trend moving in that direction. I think there's other brokers that are probably looking at it a little bit more, maybe a little bit more skepticism, thinking to themselves, some brokers have more diverse lines of business, and maybe they're not just focused on health and welfare. The ones that are more comfortable focusing on just selling insurance are just trying to sell insurance, and maybe they're trying to sell insurance that's outside of this whole PPACA healthcare reform area because that's just what they're most comfortable with, and they don't really want to expand what they're doing. There are brokers that we've talked to that, know that it's going to be a reality. They're concerned that their employers are going to just decide to throw their hands up in the air and drop coverage altogether. And so those brokers are focused on trying to convince employers not to do that. And I think they have some powerful arguments in favor of that position as well.
Now, Bart, I think that parallels a lot of the discussions that I've been having. I spoke at a AHU Atlanta Health Underwriters meeting not too long ago, and a large group of them are attending our forum, as are some on the national level. And I think that's Brokers Advisors is the fastest growing segment of our attendee effort around Forum East. I think it signifies that they're trying to figure it out. Their eyes are wide open right now, and they're trying to figure out, what seat at what table they can have.
Absolutely. I mean, traditionally the business has been selling insurance and collecting a commission on that.
Yeah.
And now, while that opportunity still is probably going to exist, it's probably there's being some pressure applied to that. There are so many other opportunities in this world because healthcare is so complicated, and it's only getting more complicated. And the question is, how entrepreneurial can these folks be in creating value or expanding what they already do in an effective way in this world where there are all these other opportunities, but there's no real clear direction or solution or ability to predict what's going to happen. I mean, the law is so complicated, it's very difficult to predict 5-10 years from now what the landscape's going to look like. Changes
every day. Hey, I want to give you a chance to talk a little bit about, and you're going to talk about this in your workshop at Forum, so to our audience out there that's going to be in attendance, please be aware of that. But talk to us a little bit about what you're doing around card-based benefit programs and where you see, the opportunity for them within these programs going forward.
Yeah, absolutely. Well, I mean, for those of your listeners that don't know, I mean, this is kind of Ameriflex's bread and butter. This is sort of we've been, dabbling isn't a good enough word. We've been doing this since the late 90s. We were, in fact, one of the first administrators to ever stick a prepaid debit card on a flexible spending account. And so what I'm going to be doing is talking about the programs that have existed for a while and ways that they can be reintroduced by employers to employees in such a way that can help employees become more comfortable with the idea that they're going to be responsible for managing some of their healthcare dollars. And if employers are effectively able to use these tools to do that, they'll see their costs increase at a lower rate than their competition. That's kind of the going theme with what I'm going to be presenting is that, yes, if you're really, really aggressive and you have a really healthy population and are very engaged in their healthcare spending, you can have your costs pretty flat. You can have them even go down. But in the world that we live in now, costs are probably going to be going up for everybody. And so the name of the game for an employer is, do you see value in offering benefits in the first place? And there's strong arguments in favor of that. Both, like the non-economical arguments are increased morale, increased employee loyalty, increased engagement. I mean, those things, and they have monetary value you can assign to them. But those are the non-tangible values. And then, of course, I think there's a strong financial argument as well if you're able to engage your employees and, again, put some of the responsibility on them, but use some tools like flexible spending accounts with debit cards, that being the sort of traditional old version of a debit card-based program, to instead of saying, this is going to be easy, this is a tool for you to get accustomed to tracking your healthcare spending, because that, by nature, is how an FSA works. We're going to give you this card, and the card is going to prevent you from having to pay out of pocket for your out-of-pocket expenses. The card is basically kind of a free line of capital for you.
Right.
But you got to keep your EOBs and you have to keep your receipts, and you're going to have to be accountable for that under IRS rules. And in the past, that's been interpreted as something that's kind of a pain in the butt, which, frankly, it is. It's something the IRS requires you to do. But in this world that we live in now, employees are going to have to take more responsibility for their healthcare expenditures, and this is what I'm calling the gateway drug for getting employees to do that. So it can be redeployed and reintroduced as a tool for employers to engage employees and get them accustomed to the idea that they're going to be responsible for more of their expenses. So I'm going to talk about FSAs, but I'm also going to talk about some newer things that we're doing with health reimbursement arrangements, or HRAs. And HRAs have been around a much shorter period of time. I won't get into too much detail. I realize we have limited time, but I'm going to talk about some different plan designs that we have sold and we are administering for employers, and we work with well over 5,000 employers just for spending account programs, and with a prepaid card attached to them, and some case studies of how certain plan designs with health reimbursement arrangements, where an employer is basically giving an employee some money and saying, hey, you can spend it on these things. Out-of-pocket expenses, and it can be customized and restricted in a number of different ways, and show how, if you do that effectively, you can actually see your costs stay pretty flat or increase at a lower rate than other people. And then I'm going to talk a little bit about some of the things that we're doing with wellness programs, some of the newer things out there, and some of the newer things that car technology can do in terms of getting down to the individual product level at a merchant. And so discount programs, wellness programs where if you do the right thing in the wellness program, you get an incentive. The incentive can be controlled tightly by car technology in terms of what you're allowed to spend. So it's basically taking a technology that's existed for a while, adding some new magic to it, and allowing you to, as an employer, to engage your employees by making it fun and making it more like a game. Trying to take something that is inevitable, employees having to be more responsible for their own behaviors and their own expenditures, and trying to sort of, I hate to use the word gamify, that's something that we hear a lot, but trying to make it more engaging and more fun using this technology. Very, very interesting.
When you look across your employer customer database and working with your brokers, there's this constant debate out there. Are employers going to drop coverage altogether? You see the surveys coming out saying, no, that's not going to happen. What do you see, Bart? What do you see from your seat?
Well, I love it when people ask me to make predictions. It makes me feel important. But obviously, predictions are dangerous. But here's what I know. Factually, what I can say today. I know that McKinsey did that survey right when the law was passed in 2010, and I think something was like 30% or 40% of employers said they'd think about dropping coverage. Mm-hmm. I think that was hastily done. Yep. If you look at the options, dropping coverage as an employer, again, you're going to lose all those intangibles of employee engagement, morale, those types of things. And on top of that, you're going to pay penalties, and those penalties can be very, very stiff. In addition to that, you're going to have a core of employees. Most employers have a core of employees that are very important to them. The talent is generally the most important asset that an employer has, that are going to demand the same health care benefits that they had before. So if you, as an employer, you're saying, we're going to get rid of everything, you're going to have a core of people that are going to say, okay, fine, but you have to make me whole for this because this is something that's important to me, and I'm a very talented person. I can go somewhere else that's offering a better benefit, which is the reason why employers offer those benefits today. There's no penalty for not offering them today. And so in order to do that, if you have that core group of employees and you're making the decision to drop coverage, you're going to have to gross up their pay. You're going to have to compensate them for going into the government exchanges and buying individual policies. And, again, despite what you might think about what the costs are going to be for those individual policies, and I personally think they're going to be pretty high. This is why there's going to be the subsidy program for people that, 400% of poverty level or lower. That's to mask all of the things these plans have that are making them very, very expensive, and the limited underwriting that's allowed for these plans, going to make them expensive. So you're going to have to gross up those people's pay in order for them to afford to pay for those programs in an exchange. And you're going to have to do it on a post-tax basis because, remember, when you're giving people employee benefits, you're doing it on a pre-tax basis in almost all cases. You're doing it through a Section 125 plan. And so that's could be anywhere from a 15% to a 35%, hurdle you have to go over on top of the increased cost, the likely increased cost of individual coverage in the exchanges. And so when you do that math, that ends up being, in my mind, and I've done a lot of spreadsheeting on this, talked to a lot of people, that ends up being way more expensive than just continuing to offer a plan. Now, offering a plan is going to be expensive as an employer, but not offering a plan, to me, is going to be much more expensive. And so that's why my presentation is focused on continuing to offer plans because of all the intangibles, and again, because I think hard numbers financially, it's going to make more sense. And then doing things creatively to engage employees so that your costs are increasing at a lower rate than other people.
Hey, Bart, this is I hate to cut you off, but time flies, we're having fun, and I think we're going to leave that with the audience because there's a lot of valuable stuff. They can come and listen to you at Forum East. So I appreciate you being with us today, and to our audience, stay tuned for the next segment of Healthcare Consumerism Radio. You take care.
This is Doug Field, the CEO of the Institute for Healthcare Consumerism, and I invite you to join us every Friday at 11 o'clock for Healthcare Consumerism Radio.